If standard therapeutic approaches are not entirely sufficient to effectively cure a particular cancer, in some specific cases, only an autologous blood stem cell transplant procedure can genuinely help to control the cancerous cells in the long term and provide a more lasting solution. Autologous blood stem cell transplant procedure means that stem cells are taken from the patient themselves and later returned to the patient's body. So there is no donor required, because the recipient and the donor are one and the same person. But why go through all this in the first place? Well, one reason is that the transplantation of stem cells is an essential prerequisite for being able to carry out high-dose therapy at all. High dose here means that a very large amount of cancer medication is administered in a very short period of time. The goal of all this is to completely destroy every single cancer cell in the body. But this strong chemotherapy doesn't just target cancer cells, it also destroys the bone marrow. After that, the body is no longer able to produce new blood, and that's where the reserve stem cells come into play. They are supposed to rebuild the bone marrow. Of course, this usually only works if the body's own blood stem cells are healthy. Otherwise, you would be putting diseased cells back into the body and nothing would be gained at all. So, once it's clear that your child or you as a teenager needs an autologous stem cell transplant, you're probably wondering how the whole process actually works. That's a very good question. So let's get right into it now. One could compare a transplant procedure quite well to a long journey over a very high mountain, because the treatment follows a set route up the mountain and back down again. But before you set off, everything has to be perfectly prepared and planned. That's obvious, right? After all, you wouldn't try to climb Mount Everest in flip-flops and just a sleeping mat under your arm. So, like a real mountain expedition, we're down here at base camp, as people like to say, before the actual ascent begins. This means, for an autologous stem cell transplantation, a lot of preliminary examinations have to be done first. During these, your child's general state of health, or yours, if you are affected as a teenager, is examined very closely because you need a lot of strength just to be able to embark on this journey at all. And the most important thing you need as preparation for the journey, of course, are the stem cells. But how do you actually get them? Most of the time these days, this is done through a special type of blood draw. To make this work, the patient will receive an injection of medication for several days in advance. This really boosts the production of stem cells so that they enter the bloodstream. Then the patient is connected to a special machine that filters the stem cells out of the blood. The collected stem cells are then deep frozen and stored until they are needed again after the treatment. Only once all of this is done does the actual treatment begin. The first stage of this treatment is the climb up the mountain and is called the conditioning phase. This usually consists of a high-dose chemotherapy. What that means, as we discussed at the beginning, is a lot of medication in a short period of time. Of course, such a high-dose therapy is extremely exhausting for the body. To make sure the patient is not becoming too weakened, this conditioning phase will only last a few days to about a week. Now, all the cancer cells should have been destroyed, but at the same time, so has the bone marrow. A day or two later, the time has come. Now comes the transplantation phase. Day 0, meaning you have now basically reached the summit of the mountain. And day 0 in your treatment plan is the day on which the stem cells are transferred. For many affected people, it is something very special. But even if the whole situation may feel new and challenging to you, the transplantation procedure itself takes place without much fuss. The stem cells are thawed again and simply administered just like a regular blood transfusion. There's really nothing more that needs to be done. The stem cells will actually find their own way back to the bone marrow all by themselves. So now it's all about making it safely and soundly back down the mountain. Usually, going down is faster than going up, but with a transplantation, it's a bit different. At the very beginning, you're in the ablation phase. From day 0 to about day 21, during this time, the body is still completely defenseless. As you know, the strong chemo has wiped everything out at first. As a result, blood counts drop to rock bottom and the body is extremely susceptible to infections. For this reason, you or your child may sometimes have to stay in a sterile single room for a while, though not always. These rooms, for example, have an air filtration system that keeps all germs out. It then takes about 10 to 20 days to reach the next stage, the so-called regeneration phase, which is roughly from day 10 to day 28. During this period, the transplanted stem cells grow in the bone marrow and begin to produce new blood. However, it still takes some time until the blood values normalize and the immune system is fully up and running again. If you are still staying in a single room by then, you or your child can start taking the first small trips out of the room. Most people can hardly wait for this moment. But you still have to stay in the hospital until your blood values have stabilized sufficiently. Even then, you still haven't reached the end of the journey. After discharge, the outpatient phase follows. Regular checkups will still take place to make sure that everything is really okay. Especially in the first 3 to 6 months after the transplant, complications can still occur. But the good thing is, if the stem cells don't come from another person but from the patient themselves, there can't be a rejection reaction. That's why you don't have to take any additional medication to prevent such a rejection reaction. Compared to a transplant with donor stem cells, the descent here, one could say, is a bit less steep and bumpy. Most of the time, after 3 to 6 months, people are already feeling well enough that, as they say, they're over the hump and the treatment is considered complete. Of course, this is a little different for everyone. It simply takes time for the body to recover from all the strain, and also for the immune system to be back at full strength. So if you like the idea with the mountain, you could consider making a mountain for your child's or your own journey. You can also draw it, print it out, or do whatever you like. It all depends how creative you want to get, and then you can always mark where you are in your therapy and what you have already accomplished. That can be very motivating. It can also help to visualize time better when dealing with young children. Just give it a try.